Hey, I'm Dr. Rich. Thanks again for joining me for another episode of Reading a Panoramic X-ray. So this X-ray is an old one. So first of all, let me first apologize for the quality of it. This is a digital photo that I took of a 20-something-year-old panoramic X-ray. So it's a film X-ray that was sent to me by the oral surgeon who placed the implants. And this is obviously after I put the teeth on it. As you can see that there's teeth on the implants. So let me give you some backstory first, and we'll kind of talk about the X-ray while I'm at points two during the backstory. So this patient, longtime patient of mine in the practice, he's always had trouble with periodontal disease. He was a smoker for a long time, not the best with his home care, and so if you look at his lower teeth in particular, he's not missing any lower teeth. They're all there, but he's got quite a bit of bone loss on the posterior teeth, so that it's his molars and premolars on both sides, his lower right-hand side, lower left-hand side. He's got quite a bit of bone loss. He's got enough bone loss that, especially on that second molar on the bottom left-hand side, the bone is missing from the furcation. The furcation is the area in between where the two roots of the molar meet. And you can see that dark area right in there. So he's had some bone loss on all the bottoms, not enough to lose any of them. Where he struggled the most was his upper molars. When I first met him, was already missing his upper molars, and he was missing one premolar on one side, and he had a partial denture. He had some bone loss on his upper teeth, but they were still somewhat stable, and he was coming in for cleanings fairly regularly. Again, his home care wasn't the best. At this point, he was no longer a smoker because he had a couple precancerous lesions removed from underneath his tongue, so that scared him enough to give up the smoking. He was a pipe smoker as it was. But then he ended up losing another premolar. So up on the upper right, you can see, on his upper teeth, you can see his two central incisors right in the middle. And then going towards his right, he's got his lateral incisor, his canine, and he's missing the two premolars and the molars. That first premolar, so that was the last one they had left, I actually ended up extracting that on him because it got so loose to the point that it was bothering him. It was also the premolar that his partial was resting on. And at that point in time, we ended up having to extract it. We added it to his partial. And so now we had to add a wire clasp to his canine. And he was worried that if this continues, he's going to end up losing all his upper teeth, and he didn't want a denture. And 20 years ago, all-on-4 was available, but it wasn't super common, even for what he needed to have done for these implants, which we'll get to. I'll tell you about that. But this was turn of the century, basically late 90s, early 2000s. So he decided, he just took it on himself to go find himself an oral surgeon without even discussing anything with me. He went see an oral surgeon, and this is the plan the oral surgeon came up with. The oral surgeon placed some implants on the upper right-hand side. You can see he's got 4 implants. These are all 15 millimeter long Frialit implants. I'm not even sure if Frialit is around anymore, if they got absorbed and bought out by another implant company. But they have a unique look. It's almost, if you look close, you can see it's almost like a stepped pyramid type of appearance to it. But because the patient was missing his jawbone, was missing his molars for so long, he also needed bone grafting to place the implants in. On the right-hand side, you can see that first implant closest towards the front of his mouth. That appears to me to be completely in the patient's natural jawbone. But then going back, I can see this kind of, I'll outline it here, this white area around here, that's all the bone graft material that was placed in the sinus, in the floor of the sinus, and then the implants were placed in there and allowed to heal. And so this particular graft material, whatever it was used, was a bit more opaque than the patient's natural bone. I don't recall exactly what the surgeon used. So he had 4 implants placed then on the upper right-hand side. Again, all 15 millimeters long. The front 2 were a little bit narrower than the back 2. And then on the left side, again, another bone graft. He only had 2 implants placed. Again, both 15 millimeters long. These 2 were a bit longer. these two were a bit wider, as you can see, compared to the right hand side. Now on this side too, the surgeon had some difficulty placing the sinus lift and the implants, to the point that when he first did this, he only placed the rearmost, the distal implant, and the front implant he ended up having to remove, let it heal for a bit, and then he went back in and placed a new one. When it happened, and this I remember because the patient had come to see me while the implants were healing to get a cleaning and checkup, and he told me about this, and I always recall that when the surgeon was working on the upper left-hand side doing the sinus lift, he perforated the membrane on the floor of the sinus, the Snyderian membrane. That's just the tissue that lines the sinus. And so when he was lifting it, he put a hole in it, basically. And then as he placed the graft material in there, bone graft material generally is just kind of like fine particulate material that gets packed up in there. I remember afterwards the patient was telling me he kept having little pieces of the bone graft material come out his nose, because from there it was going into this maxillary sinus and then going out into his nasal passages. There's a little opening to connect it there. And so that's one thing too, when you place bone graft material, it's always recommended to use below a certain size, because if the particle sizes are too big, they won't be able to pass through into the nasal cavity and out of the body. So this way, if the surgeon used very small ones, he was able to get up out of the sinus into the patient's nose and come out his nose. And so for a few months, he was, anytime he blew his nose or whatever, sneezed, he had little bits of bone graft material, just like little white, like not quite as big as a piece of rice, almost like little bits of salt, crystals of salt, even though it's bone graft material that was popping out of his nose. But even with what happened there, everything healed up well, as you can see, and we were able to eventually put teeth on there. So we splinted everything together, and so these were all just bridges. These were porcelain fused to metal bridges. You can see the metal framework there, and then you can see the layer of porcelain. So this was done over 20 years ago. And once they were in, patient was able to chew. Over the years, no problems with the implants. He did lose a couple more teeth over the years. I believe one of his canines he lost, and we ended up having to replace that with an implant. And then unfortunately, a patient passed away a few years ago. Nothing dental related, but he was a swell guy. Miss him a lot. Also, you can see the size of the implants that were used again. These were all 15 millimeters long. They were huge. Nowadays, usually 8, 10 millimeters, maybe 12 millimeters is considered really long. But I've gotten a lot of cases back from the surgeon with 6 millimeter long implants, and now one of the companies out there, a company called Straumann Implants, is marketing 4 millimeter long implants. So very, very tiny compared to these big ones that were placed back at the turn of the century. So again, thank you so much for watching. See you guys in the next video.